All right, we are on. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. I have a special guest, and actually pronounce your last name for me.
Echo.
Okay, so I have Dr. Echo here with me. I wanted to make sure I got her name right. She has taken time out of her busy schedule to be here with us. So we are so excited. The topic is going to be autism. I do get a lot of questions about this, so I'm super excited about this topic. So we're going to do some introductions, and then we're going to get right to it. So I'm going to get started first. For those that don't know me, my name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I co own a primary care practice, namely Apple Valley Family Medicine. I'm located in Martinsburg, and the goal of my practice is to have my patients not only feeling, but looking good. So, Dr. Echo, I'm going to let you introduce yourself, but thank you for being here.
Thank you, Dr. Uday. Thank you for having me on here. Hello, everyone. I'm Dr. Hokehe Eko, Board Certified Pediatrician. I am also an integrative pediatrician that specializes in ADHD and autism. So, and what integrative medicine? Yeah, the word simply means uh, conventional medicine plus evidence-based complementary medicine. So that's all that means.
I
Yeah.
love,
So,
love
and
it.
what else about me? I have three kids. I run my own practice called Glow Pediatrics, where our mission is to help children and families glow from the inside out with health. So,
That's beautiful. That is beautiful and well needed. So let's actually get right into it. So, what is autism from your perspective, Dr. Echo?
so autism is a collection of disorders, right? That we have put under this one umbrella called autism spectrum. And the reason for the word spectrum is because it's you can have children run the gamut of, or even adults, anybody, um, of being what we call high functioning, meaning you can't even tell there's anything going on with them. They just might have concerns around social interaction and communication. So let me go back to say autism, the highlight of it really is that the disorders that deal with communication socially, especially, and also social interaction. So things that we used to call like Asperger's, that's all now under autism. PDD, pervasive developmental disorder, that's all under the umbrella of autism now. So it's just a collection of brain-based disorders under one name. So yeah.
So, what would you say causes it?
So there isn't one cause, it's multifactorial, which means there's multiple factors that cause it. Some of those factors could be genetics. I mean, children, families that that have a history of autism, it's very higher risk of the child having autism. Children that are extremely premature, um, the environment does play a part. The food that we eat does play a part. What else? Things like mold and lead and all of those toxins that can attack the brain can cause autism. So there isn't one thing
Gotcha,
that
gotcha.
causes it.
So, what would you say the symptoms are of it?
So the typical symptoms you would find or you would see with children, because I deal with children, I'll talk about children, but it's the same as adults to some degree. So typically you would see children that don't like to make eye contact, like you would talk to them and or you call their name and they will do this and immediately look away. So very limited eye contact, don't like to play by themselves. Um, so if you're looking at your toddler and you speak to or you call your toddler's name several times and they don't respond, that could be a warning sign. Like they don't respond like usual. Some of them have stereotypical movements that they make, sometimes hand flapping, like if they're excited or they're angry, like that, or doing different things with their hands. There's so many symptoms again. Um, what are some other ones? They can be very picky eaters. They don't understand how to interact well with others. They don't understand the give and take of a conversation. They may just want to only talk about themselves. A lot of times there's even speech delay. So it doesn't mean that every child that has speech delay has autism, but that's a big component of it, of the
Okay.
disorder. And
Okay.
so yeah, that runs the gamut of it. And of course, there are other things like they have difficulty walking, they are very clumsy, like their milestones developmentally can be really delayed. And sometimes I've seen kids that their milestones are, they met them on time, like the walking, the talking, and all of that, but they still end up developing autism like at 2 or 3, like more signs of it. And there are some children who start off developing appropriately and then regress backwards. So like they started saying words and then stopped talking. So
Mm.
that too can be a warning sign if your child is doing something and stop doing it as well. And
What about repetitive movements?
right.
Bending or
So
things like that.
so yeah, those are kinds of the things I was talking about with the hand movement. So even like lining up toys, like
Gotcha.
they always do the same thing, or they spin 5 times, stop, spin again 5 times. It's like there's this repetitive things that they do over and over, that
Gotcha.
bring some comfort to them, but they enjoy doing it. So those are some things to look out for.
Okay. And then formally, how do you diagnose it?
So formally, there's multiple tests that you can do. I do the CARS test when I'm evaluating children. So it's clinical observation plus the testing because both go hand in hand. There isn't one test that diagnoses it. You have to take what the test shows in addition to your clinical judgment. So when we're evaluating children, we're looking for how do they interact. The DSM-5 has several criteria that we follow, and a lot of it has to do with social interaction, social communication, restrictive behaviors, which means the behaviors that they do over and over, repeated behaviors, or like very rigid thinking. If you move them off their routine, they can't handle it. They get really angry and start throwing tantrums, like they just lack the so that those are some of the things we look at for evaluating. And if it started in childhood, like in the early childhood versus late childhood, if it cannot be explained by intellectual disability, which of course that's a whole separate evaluation for that, but you have to determine that the behaviors of the child you're seeing doesn't fall under intellectual disability for you to say the child has autism. So
Gotcha. So formally, how do you treat them?
great question. So yes, so autism is a chronic illness. I will say that there are things that can be done to help the patients live a better quality of life. So for example, with those who have difficulty with speech or speech delay, it's so important that if you notice that your child isn't speaking by 18 months, not even saying any words, that it's so important that you follow up with your doctor to have them evaluated and then referred to speech. So the earlier we start speech therapy, it definitely helps. The fact that the child, I should say this, the fact that your child has been diagnosed with autism doesn't mean your child cannot improve. And a lot of times parents, once they hear that word, it means it's like a death sentence and that's it. It doesn't mean that at all. Your child's children can improve. And so when we start speech therapy early, physical therapy if they need it, occupational therapy, preferably under the age of 5, that's where you can see a lot of improvement in the behavior and in the abilities of your child. From my perspective as an integrative pediatrician, I look at the whole child. So I look at what's going on in the child's environment. I have seen children that live in a house full of black mold have behaviors
Oh,
that can mimic autism. And once they're taken out of the environment, it improves. I also, so I look at a lot at what children are eating. Um, Lots of research shows children with autism, they have a lot of gut issues. So like GI issues like constipation, diarrhea, they don't digest their foods well, and they're often really picky eaters, right? So I work on constipation, on the picky eating, because believe it or not, constipation affects sleep, which a lot of times they don't sleep well. They have difficulty falling asleep. or can stay up all night and all day. I have seen children not go to sleep at all. And so constipation, when you address that and address the sleep, the behavior of the child will often improve because the brain needs the time to sleep to repair itself. So that's the approach for treatment that I have is let's fix what they are eating. Um, let's work on their sleep. Let's work on the behaviors that we can address. Let's work on speech and occupational therapy and physical therapy. And that I have found helps the children improve.
Okay. So if there's a parent listening with a child that, either they're suspecting has autism or they, had a diagnosis of autism, what actionable tips would you give them to help improve symptoms in their child?
Okay. So some of like what I just talked about.
Sure.
So first off, when I first give the if your child has just been diagnosed, I would make sure that your child gets the appropriate referrals that they need, like speech, occupational therapy, or physical therapy, and that you follow up with that. Also, make sure that the school, if your child is school age, that they're getting the appropriate accommodations that they need to help them in school. Because the fact that the child has autism doesn't mean they are not smart. Some children with autism are one of the most brilliant people. And so it's important to advocate for your child at the school level. Now, at home, what are the things you can do? Often, I advise parents to start to do a trial of um, take off dairy and take off gluten because dairy constipates, and lots of research has shown that our bodies don't digest dairy well. So I often tell parents if we can do a 3 months trial off dairy, 3 month trial off gluten, and gluten is something that's found in wheat commonly. So it would just be switching over to foods made from rice. So like there's rice pasta, you can still eat rice, you can eat potatoes. So it's not a huge drastic change, but I have found that it makes a difference. So those two things especially, but then also children with autism are very deficient in important elements like magnesium and zinc, and they also can be anemic, right? Because like sometimes they put lots of things in their mouth, so you want to make sure to check that they're not anemic as well, because that's something that's easily fixable. And when you have low blood iron, that affects the way the amount of oxygen that's carried to your brain, right? And that affects the way your brain functions. So I often talk about the brain. I talk about everything from the angle of the brain because I want parents to understand that what's what we have to address the health of the physical organ, the brain, because that's what drives everything. So when we think about what we are putting in our mouths, we have to say, will our brain like this? And if it's things full of dye, like brightly colored food, you probably shouldn't be eating it because all those dyes, research has shown, affect the way the brain functions. So at home, I would take out the brightly colored foods, the Kool-Aids, all of those things that don't help our children anyways, because it's chock full of sugar and all of that. And just slowly replace it with alternatives. Like instead of drinking dairy, your child could drink oat milk or almond milk. And then instead of gluten, you can try more rice-based foods. So just to give their tummies time to rest. In addition, magnesium helps with constipation, which and magnesium helps with sleep, right? And those are two big things that we find in children with autism. So the one taking magnesium will take care of constipation, will help with sleep. Magnesium also nourishes the brain cells, so it helps with those three big things. So that's really my beginning approach to helping children with autism. I hope that wasn't too much.
No, it's never too much. It was good. It was actually really, really good. Thank you. So the other question I ask is, I guess this is more on the flip side to talk more about you. Why do you do what you do? I ask all my doctors that come on. So why do you do what you do, doc?
Yeah, good question. So, ah, goodness. So,
Cracking me
um,
up.
I have I have a brain story, which is what got me into the whole brain thing. And I'm not a neurologist, but I love the brain. So when I was a when I was a junior in college, I was in two car accidents back to back, 6 months
Oh,
apart, and I was told by the neuropsychologist that I was only average. And he asked me what I wanted to do. I said, I've wanted to be a pediatrician since I was 5. And he said, well, you're never going to med school. You are only average, and I suggest you go find something else to do. So I proceeded to believe the guy because obviously he's a doctor. Yeah, and I failed out of school that semester, and that was done. I was depressed. I was yeah. So, but my parents were like, "Nope, you're going back to school. Doesn't matter what he said.
it's mindset.
You
Yes.
are a doctor, and that's exactly what's gonna happen." So, I went back to school. Was it a struggle? Yes. I had to overcome what I believed, first of all,
Right.
about the fact that I wasn't good enough. Um, and, but I mean, here we are. So I did
Yay.
prevail. And then, I started thinking, like, first it started with ADHD. I had this little boy, 4 years old, came into my office, and um, they said he had ADHD, but he was also in foster care and he had been in 10 homes in 6 months. So if you have been in 10 stranger homes and you're 4 years old, I'm not sure how your behavior would be. I mean, I would think I would be crazy myself.
Right.
But so he came into my office, was bouncing off the walls. But the interesting thing was he gave me like 15 hugs. So he would run around and come back and give me a hug. And so I heard myself telling the worker, I said, no, I'm not going to give him ADHD meds. Besides, he's 4 years old. I think he needs a loving home. And I could not believe I said that. I don't know where I got that from. I think it was
Oh,
just the mommy and me and the hugs. And I was like, is this, huh? So
yeah.
the guy looked at me like I was crazy, but he did go and they got him into a really good home. So the next time I saw this child, like 6 months, 6 weeks, 6 months later, this child was sitting on the lap of this amazing foster dad. He said hi to me, gave me one hug, and no more bouncing off the wall. So I was like, where did the ADHD go? Oh,
That's it.
wait. Does that mean that trauma can affect your brain so much that it looks like ADHD? And now we know there's all this research now, right? That shows when a child experiences trauma, it makes physical changes in their brains. And so that's what led me to start doing extra reading and just finding out all these things like, oh my goodness, there is more to this than just I'm gonna evaluate you and put you on meds. I mean, the very environment you're in can make you act like you have an attention problem. And so that's what led me into ADHD. And then I did a TEDx on ADHD and I was doing all this work on ADHD. And then I left my last employed position because I was being harassed. And I was like, well, what am I going to do now? So I realized that in my state, Oklahoma, there's a 2-year wait list for autism eval. So I was like, that's something I could do. So I went and got trained and then I started doing it. And then I was like, but I can actually help these children because I noticed that the children started to, there was this pattern, right? I'm evaluating them. They all have constipation. They all have sleep. They all have sleep issues. They're all picky eaters. I'm like, but no, we're not really addressing those underlying problems, right? We just say, oh, yeah, it's autism and don't really address it. I mean, I'm guilty of that too. So that's how I really started my practice, just really for children with ADHD and autism is how can we help these children get better, right? By addressing everything going on with the child.
That's amazing. So, I mean, and it's absolutely well needed work. So,
Yeah.
thank you so much for what you do. Now, the other question is with all the experience you've had, all the life you've lived so far, if you got a chance to meet your 20-year-old self, what would you tell her? What would you advise her?
Hmm. Yes, I would tell her, don't believe what people say to you.
I love it. I love it. Because it's
Thank
not
you.
believe in yourself. Absolutely.
Yes, yes. It doesn't matter what happens. Like it's amazing how I remember being 5 and remembering I want to be a pediatrician. But yeah, I would say yes, believe in yourself. And even if you get knocked off, you can get back up again and keep going.
That
That's what
is
I would say. Yeah.
beautiful. That is beautiful. This was so good. Thank you so much, Dr.
You're
Thank you.
welcome.
Thank you. So, for people that want to look you up, they want to schedule appointments, they want to connect with you, how can they do that?
Okay, well, multiple ways. So
Mhm.
my podcast just launched today, Brain Power with Dr. Echo. It's
Woo!
it's at thank
Yeah.
you. It's on Apple, Spotify, and all the places you can listen to podcasts. So that's one place, and that's a weekly podcast focusing on practical strategies to help parents and children boost their brain, guts, emotional, and environmental health. And then my practice is Glow Pediatrics. So it's www.glowpediatrics.com. And on there you can leave a message to schedule an appointment with us. Or I'll give Dr. Uday a phone number, which is, do I remember my phone number? I'll give it to
Don't,
you.
don't worry, we'll put it in the show notes.
We'll
Don't
put
you
all,
worry.
yes, and I'm on Facebook, LinkedIn, Instagram at Glow Pediatrics. So yes.
Oh, congratulations on the podcast. That
Thank
is
you.
awesome. This was
Yeah.
so good. So, you guys definitely check her out. She's an amazing doctor. On the flip side, if you're looking for a quality family medicine physician, we are accepting new patients at Apple Valley Family Medicine. We're open 7 days a week, 9 to 5 p.m., Monday through Sunday, and we would love to take care of you. You can call us at 304-350-1087, and you can find us online at www.applevalleyfamilymed.com. You guys have an amazing week. Dr. Eko, thank you so much.
My
Thank you.
pleasure. Thank you for having me.
This was fun. This was so